Hello friends, I am Dr. Sumit Jaiswal, plastic and cosmetic surgeon, and I am from Zenith Cosmetic Surgery Center. Today we are going to discuss with you rhinoplasty procedure or nose job cosmetic surgery. We are one of the leading center in India who is performing large number of such type of surgeries every month, and we are doing such type of practice since 12 years. So rhinoplasty is a very broad variety of procedures in which the requirement of procedure vary from just 15 to 20 minutes or up to 3 to 4 hours. So it vary from nose to nose. Many people have depressed nose, so we can increase the height. Some people have broad nose, we can decrease the width, especially in upper part. If it is, then we have to break down the bone and push it inside. If it's lower part which is broad, we have to do LR base reduction procedure. Similarly, if tip is rounded or blunt, we can make it sharper, we can make it smaller, and we can lift it if it is hanging tip. There may be a deviation in the nose which we can correct by osteotomy and other maneuvers. Sometimes the problem is due to trauma. In that case, the case will be difficult. In such condition, we have to correct the septum and external nasal bone deformity also. Some people have deviated nasal septum which can lead to breathing difficulty. In such cases, we have to do septorhinoplasty, in which we correct the septum and obviously external visible part of the nose also. So by some of the photographs, we will discuss you what changes is needed in such type of cases. And if you have some concern about your nose, you can WhatsApp us or call us. You can send your photographs so that we can tell you the cost which will occur to you. The range of cost for rhinoplasty is starting from in Indian rupees 50,000 rupees to 80,000, 85,000 rupees, which is around $800 US to $1,000 US. Our main center is in Indore, Madhya Pradesh, which is in India, and we are available in 8 other major cities of India also. So you can choose wherever you want to go for surgery, but preferable is main center, that is Indore. She is 34-year-old female whose complaint is the depressed nasal dorsum. So it's very common problem in Indian perspective in which the nose is depressed. So we have to we have to increase the height of the nose. For that, we can use autologous material like nasal septum or ear cartilage or rib, or we can use silicone also. We also corrected tip in this patient, and LR base is also reduced. We very commonly use silicone in our practice, and none of our patient got any problem in future due to this silicone. He is 28-year-old male. The main problem in this case is that the lower part of the nose is broad, tip is depressed, the holes or nostrils are very much big. So what we needed in such case is we want to decrease the width. For that, we have to increase the height of the tip, by which the width will decrease. We need some columnar strut to give support to the nasal tip. The tip need to be sharpened, its width need to be decreased, and also we have to do LR base reduction or nasal flow reduction to decrease the width in the lower part of the nose. The suture used in such cases are self-dissolving stitches which dissolve in next 2 weeks, and dressing is needed for 5 to 7 days, and medicine is advised for 5 to 7 days also. You have to stay in the hospital just for 1 day maximum, and you can resume most of your activities from next day. She is a 28-year-old female. The main problem in this nose is the tip, the dorsum is depressed, the tip is blunt, tip is broad, the tip need to be sharpened, and the height of nose need to be increased. So you can see just immediate post-op result. There may be some swelling after the procedure which subside in next 3 weeks to 2 months. This is immediate post-op result. This patient from Punjab has a very big nose. The nose is depressed. The lower part of the nose is very broad. The lower lateral cartilage are very big. In such cases, we need reduction rhinoplasty, in which we decrease the size of cartilages. The tip need to give some support. Dorsum augmentation procedure is also needed. In lower 2 images, you are seeing a post-operative result. There may be some swelling after the procedure, and so the final result will appear in next 6 weeks or 10 weeks. This is another common problem in which on lateral view we can find hump in the nose, and the tip is at lower level as compared to dorsum of the nose. Normally level of tip should be more projected as compared to the dorsum. So in such cases we have to decrease the hump. The hump is formed by bony or cartilaginous part. We have to reduce it. Many times osteotomy is also needed in such cases, and the tip need to be lifted. Tip augmentation or tip sharpening procedure is simultaneously needed in such cases. And this is the last case of this video, in which the patient has nasal deformity because of trauma. He has road traffic accident 6 months back, by which at that time nasal bone were fractured, not properly managed. Septum was also deviated because of the trauma. We have done septoplasty procedure, nasal bone refracture, then proper alignment of nasal bone, and dorsum augmentation, tip correction, and its support to the tip is also given. There is a lot of edema and swelling after such type of extensive procedure, especially when osteotomy or bone breaking is done. So final result will appear after 3 months or maybe up to 4 months. But most of the swelling subside in first 2 weeks, and there is no problem in socially interacting with people after 4 to 5 days, because after 4 to 5 days we will remove the dressings. We have many other videos of post-operative results, but they may be in Hindi. You can observe those videos also. If you have any queries, you can WhatsApp your front, lateral, and worm eye view of your face. We can give opinion about what type of rhinoplasty needed and what will be the cost for you.